Hi class, this is Miss Bacon and I wanted to create this PowerPoint because I think it's very important that you have a visual of the different insurance cards that you'll come across working in the front office. So I've entitled this PowerPoint Insurance Companies Overview, but it's really sort of a visual exercise in the different insurance cards that you're going to come across. So I wanted to expose that to you because I think it's helpful in becoming familiar with these cards. So we're just going to look through the different cards. Here's a bunch of different logos, right, of the major private insurance companies out there. We've got Blue Cross, Blue Shield, United Healthcare, Aetna, Humana, Cigna. Those are the big ones you'll see. And this first section, we're going to focus in on the private insurance companies, right? That is different from the public sector, which are the government insurance plans like Medicare, Medi-Cal, TRICARE, Champ VA that are funded through the government. So the private sector is what we're going to look at first. So usually patients get their health insurance through their employer. And when we're adults, usually it's going to be like through a private insurance company. And then when we retire, we get Medicare. So we have here Aetna. Here's what Aetna looks like. And just know the ID number always starts with a W. They have sort of a red logo. And on this PowerPoint, I've included like the claims addresses, the major ones for us here in California that you'll be sending them to. So it's really important when you get someone's insurance card, you're going to scan it to their chart plus their driver's license. And on the back of their insurance card, you want to make sure to input the correct claims address. So you can see here on this card that the P.O. box is that 981106. So it matches up to this address here. And it's really important that you enter the correct claims address into the insurance and the patient's chart, as well as, their correct ID number, enter their name in their chart, how it is written on their card. That makes a big, huge difference. Everything that you input into their chart needs to be accurate, very accurate, super important to prevent denied claims. Now, another one, this one you're not going to see so much, right? But at Hoag, we do take it. So there's First Health as well as Coventry. They're kind of the same company. So I put them on the same slide. So that's what their logos look like. You don't really come across it that much. Blue Cross, this one's huge. Blue Cross is huge. You're going to come across Blue Cross very often. And they only have one claims address here in Los Angeles. And their logo is a Blue Cross on their card. And you'll notice too, on the front of the card, right, with Blue Cross Blue Shield, the ID number always begins with 3 letters. The type of plan is always in the right-hand lower corner. Usually patients have like an HMO, PPO, POS, EPO. Those are kind of the major ones, right? So that's important to know because if it's an HMO, you have to make sure that they have your doctor selected as their primary, that they're in network with your group, that they're not with Kaiser, that they're with Hoag, with a Hoag doctor as their primary, especially if it's an HMO. If it's a PPO, it doesn't matter. They can go anywhere. If it's an EPO, you got to be careful too. You got to make sure that they're in network. If it's a POS, it's okay too, because a POS is kind of like a hybrid between an HMO and a PPO. So they can use their PPO benefits to come see you. But definitely with that HMO, make sure that if you work at Hoag, that they have a Hoag doctor as their primary so that they can come to you. And you'll notice too, right, we have here some important information like the effective date of their insurance that you have to put into their chart. The RX bin, this is if you have to do pre-authorizations for their prescriptions. So in Cover My Meds, that website, you would input that number and it'll give you the correct form to fill out to pre-authorize their prescription. Also, we have here on the right-hand side, let's see, their deductible amount. So this is for the individual versus the family. Their out-of-pocket maximums for the individual and the family. Their coinsurance, once they reach their deductible, they're covered at 80% and they're responsible for 20%. They have to pay $45 to see the doctor when they come in. Okay, so you have lots of good information on these insurance cards. So moving on. Here's Blue Shield, right? So Blue Shield has a blue shield as the logo. And lots of similar information. The ID number, just like Blue Cross, always begins with 3 letters. Next up, you will also see combos, Blue Cross Blue Shield. So when you see that combo type of insurance card, their claim address you will send to Red Bluff. And you can see here there's some different copay amounts depending upon where you're going, right? If you're going to the office, it's 20. If you end up in the ER, it's 100. And again, here's that RX bin number if you have to do a pre-authorization for a prescription on covermymeds.com. Here's what the Cigna card looks like. It has sort of a little tree as their logo. And Open Access Plus is a PPO. And here's their claim addresses that you'll come across. We also have HealthNet PPO. And this is what their logo looks like. It's got that H and N. Let's see. This one is a PPO. This one's an HMO. So just remember with an HMO, it costs less. The plan does because you stay in network. You are within a particular group. So I have an HMO. I have a Hoag doctor as my primary. So my medical group is Hoag Medical Group. I can't go outside of Hoag Medical Group. It will not be covered. That's how an HMO works. If I had a PPO, it would be a totally different story. I could go to any medical group. I could go to any doctor. They would most likely take my insurance. So with PPOs, there's lots of freedom of choice. You can see any doctor. You don't need a referral to see a specialist. And you have to pay a lot more for that freedom. So PPOs cost a lot more, but you don't need referrals to specialists. You don't have to designate a primary care provider, unlike an HMO. But again, you pay for that freedom. With an HMO, it's much more affordable to have an HMO. And we also take Oscar Health EPO. This one, you're not going to see it that much, but the Oscar card, it has sort of an O on the card. United Healthcare, this one you're going to see a lot, right? In United Healthcare, they own GEHA, they also own UMR. So all of those companies kind of fall under the same umbrella, United Healthcare. So this is what their cards look like. So this one you can see that it's a family plan. Right here's the subscriber and the dependents on the plan. And they pay $25 for primary care, $40 to see a specialist. And here's their copays for prescriptions, depending upon the tier that they get. So let's look about that. And again, United Healthcare owns UMR, so that's why I have them lumped together. That's what UMR cards look like. So moving on. Okay, so that kind of rounds it out for the major private insurance cards you're going to see out there. So I thought that was a good visual exercise. So now let's look at the public insurance companies that were created by the government, right, to take care of certain populations in our country. So starting off, we have Medicare. So throughout our working adult lives, we pay into Medicare so that when we retire, we have health insurance through Medicare when we reach 65 years of age. So this is what your Medicare card looks like. And Medicare, we have both hospital Part A benefits as well as medical Part B benefits. And just note, when Medicare first came out, it was sufficient, but as time went on, patients realized Medicare was not enough coverage. So that sprung forth the development of all these Medicare Advantage plans. So you can get an HMO or a PPO plan through all these different private insurance companies with your Medicare. So if you do decide to do that, every November, you pick an HMO or PPO plan, say through Blue Shield or Health Net, and you, with your Medicare Part A and B, you roll it over into Health Net, and then Health Net also gives you an HMO plan or a PPO plan, plus also prescription drug coverage. So you have a complete health insurance plan. It's better coverage for us as individuals. Okay, so if a patient does this, you just bill their Medicare Advantage plan. You don't bill their Medicare card too. You just bill this when you're setting up their chart. Here's Scan HMO. This is a Medicare Advantage plan. It's an HMO for Medicare patients, Scan HMO. There's also Medicare fee-for-service plans. These are going to be your PPO plans. And again, they're Medicare Advantage plans. And all of your benefits get rolled over into the PPO, so you just bill the PPO. Just note too, so some patients, they just stick with their Medicare, their straight traditional Medicare. Some patients, they go into a Medicare Advantage plan, whether it be HMO or PPO. Other patients, what they like to do is they like to stick with their traditional Medicare and also get a supplement. This would be a Medigap plan. So you would bill Medicare first and the supplement second. So those are the three major ways you can structure your Medicare. So you can do Medicare by itself, a Medicare Advantage plan, or Medicare with a supplement. Now that wraps it up for Medicare. On the other end of the spectrum, we have Medi-Cal, and this is Medicaid benefits for it would be low-income patients who are unable to afford health insurance. So this is what their cards look like, and it helps to cover them in California. We also have CalOptima, which is a HMO version of Medi-Cal. TRICARE, these are the insurance cards for the military. We also have CHAMP VA. These are the insurance cards for the disabled vets. And that wraps it up. Thank you so much.